Welcome to Derbyshire Farmers. Today we'll be discussing an important metabolic condition in sheep. Acidosis, also known as lactic acidosis, ruminal acidosis, or grain overload. Overview of acidosis. Acidosis is a common metabolic disease in sheep caused by the rapid fermentation of grains or high-energy feeds, leading to an overproduction of lactic acid in the rumen. It occurs when sheep consume excessive amounts of grain or pellets, especially if they're not used to such a diet. As the pH in the rumen drops, an acidic environment forms, disrupting normal rumen function. This shift in rumen acidity can have serious health consequences for the animal. Causes of acidosis. Acidosis is commonly triggered by an abrupt change in the sheep's diet, particularly an increase in grains or high-energy feeds. Grains like corn, wheat, or barley are quickly fermented in the rumen, producing large quantities of lactic acid. Without a gradual introduction to grains, the rumen's natural microbes are overwhelmed, leading to lactic acid buildup and a drastic drop in pH. This acidic environment hinders the growth of beneficial bacteria, resulting in ruminal upset and acidosis. Symptoms of acidosis. Identifying the signs of acidosis early is crucial. Sheep affected by acidosis often appear depressed and listless. They may seem weak, reluctant to move, and sometimes even show signs of abdominal discomfort, such as lying down frequently or grinding their teeth. Some key symptoms to watch for include depression and lethargy, loss of appetite, abdominal pain or bloating, diarrhea. In severe cases, sheep may even become recumbent, unable to stand. If left untreated, acidosis can be life-threatening, so timely intervention is essential. Treatment options. Once acidosis is detected, treatment should begin as soon as possible. One of the most common and effective treatments is to drench the affected sheep with an antacid. Antacids help neutralize the acid in the rumen, restoring a healthier pH balance. Some recommended antacids include carmalax, bicarbonate of soda, commonly known as baking soda, products containing magnesium carbonate or magnesium hydroxide. Administer the antacid carefully using a drenching syringe, following proper dosage guidelines. For more severe cases, consult a veterinarian who may provide additional support, such as fluid therapy or antibiotics. Prevention tips. Preventing acidosis is always better than treating it. Here are some tips to reduce the risk. Gradually introduce grain into the diet. Start with small amounts and increase over a period of days or weeks to give the rumen time to adjust. Provide a balanced diet. High-fiber forage like hay should make up a significant portion of the diet, helping maintain a stable rumen environment. Regularly monitor sheep for early signs. Keep an eye on their behavior and appetite, especially during dietary changes. The recommended dose of grains for sheep depends on factors such as their size, age, reproductive status and purpose, like meat, wool, or breeding. Here are some general guidelines and considerations. Recommended grain feeding. Lambs. Dose. Up to 0.4 kilograms of grain per day. Grain is often combined with forage to meet energy needs for growth. Use pregnant or lactating. Pregnant, 0.2–0.4 kilograms of grain per day during late gestation. Lactating, 0.5–0.8 kilograms of grain per day, depending on the number of lambs nursing. Maintenance, non-productive adults. Generally, grain is unnecessary unless forage is poor. If used, limit to 0.1–0.2 kilograms per day. Finishing lambs for market. Gradually increase grain to 0.9 kilograms per day alongside good quality hay. Introduce slowly to avoid digestive issues. Types of grains for sheep. Corn, high energy, ideal for finishing lambs or supplementing lactating ewes. Should be cracked or rolled for better digestibility. Barley, good energy source but lower in fiber than corn, useful in balanced diets. Oats, high in fiber, better for maintenance or as a starter grain for lambs. Wheat. High energy but should be limited to avoid acidosis. Blend with other grains. Sorghum. Similar to corn in energy but less palatable, works in mixed rations. Soybean meal, protein supplement. Often used to balance protein needs in growing lambs or lactating ewes. General tips for grain feeding. Introduce slowly. Sudden introduction of grains can cause acidosis or bloat. Gradually increase over 7 to 14 days. Balanced diet. Always pair grains with high-quality forage or hay to prevent digestive upset and ensure fiber intake. Supplementation. Consider adding minerals or a sheep-specific mineral block to prevent deficiencies. Avoid overfeeding. Excess grain can lead to obesity, laminitis, or metabolic disorders. If you're managing a specific flock or have unique conditions, consulting a livestock nutritionist or veterinarian can help tailor a diet plan. By ensuring a slow and steady introduction of a minimal amount of grains, you can reduce the risk of acidosis and keep your flock healthy. Acidosis is a serious condition, but with awareness and careful management, it can be effectively prevented and treated. Remember, if your sheep display any of the symptoms we've discussed, it's important to act quickly and seek veterinary guidance if needed. Thanks for watching. If you found this information helpful, please consider subscribing to our channel for more animal care tips. Until next time, take good care of your flock.